Good day, fellow learners. Once again, this is your mentor, your fact check buddy, Ray Gapuz, welcoming you to another learning session. This time around, we're going to talk about case number 50. And before anything else, let me first share with you what this topic is all about. So we'll talk about bronchiolitis, otherwise known as acute viral bronchiolitis, or respiratory syncytial virus bronchiolitis, since RSV is the most common cause, or it's also sometimes known or called infantile bronchiolitis for the type that would usually affect children under 2 years of age. So before we dig deep into RSV or bronchiolitis, join us in this mission. Our goal is to provide free NCLEX RN application and review to 500 nurses. To help us achieve this, just watch and finish the ads in our videos. And please don't skip and share if you want to our team to be part of your prayer warriors. Share this video to at least 10 of your friends and we'll pray for your success. So thank you so much for not skipping the videos in advance. Before anything else, let me say congratulations to Maria Victoria Sarmiento of Baguio Central University, who passed the Next Generation NCLEX RN for the state of New York last August 18, 2025. And let's learn from her success recipe. Isaiah 60 verses 22, I the Lord will hasten it in its time. Truly, while God will act swiftly, his actions will align with his divine schedule, not human impatience. First of all, thank you so much, Almighty God, for everything. I'm really grateful for giving me courage, strength, and wisdom to make it successful. Also, I'd like to thank my family for their outpouring support in this journey. I couldn't have done it without you. To our mentor, Doc Ray, thank you for your incredible guidance, for imparting your knowledge, your expertise, and wisdom. Gave me confidence to achieve this success. Thank you very, very much, Maria Victoria, for the very kind words. And to the whole RAGRS family, to our IT team, to our staff, to all our mentors, thank you so much for everything. My NCLEX preparation was never easy for me because I graduated way too long ago. So when I found that Ray Gapuz review system in Baguio, I enrolled right away. With the help of RAGRS, gave me the grit to take the test. The comprehensive review and NCLEX U11 pharmacology book helped me a lot to know all the concepts needed in passing. Okay, once again, congratulations, Maria Victoria Sarmiento. Okay. So for those of you who are asking which is a good learning tool for the next generation NCLEX RN, here are some key messages from those who use my book, NCLEX RN 311, the next generation QUICKFIX edition. So in Filipino, parang reflection po talaga, sir, ng QUICKFIX YouTube and our 311, yung questions that I got. So happy I got through the exam successfully. Thank you po, sir, ng marami. So parang actual, that's what they're saying. And then Chin says, also came out. I was like, Sir Ray, know what topics would come out. I'm glad I'm a Ray Gapuz baby. So they're saying patok. And then sincerely speaking, if it were not for NCLEX U11, I would not have passed. I went through it the last 4 days of my exam. That book is amazing. Keep up the good thing of helping us nurses. And of course, NCLEX 311 po the best. And this is what she says in Filipino. Halos same na same po siya sa pagka-construct sa mga na-encounter ko pong standalone questions. Legit. So what this feedbacker is saying is that the construction of the questions in the book are almost the same in the questions on the actual test. So we have a promo for $3,499 with the 3 books. Plus, you'll get the opportunity to join my 3 days QUICKFIX Focus Review. The QUICKFIX Focus Review is a 3-day review, 24 hours with me, and then you'll be using our NGN simulator. So on to our case number 50. Once again, we're going to talk about bronchiolitis. So RSV is a common cause of bronchiolitis and pneumonia in children. Now, what usually happens in RSV? So the respiratory syncytial virus infects the epithelial cells lining the small airways or the bronchioles, and this would lead to airway swelling and mucus overproduction by the goblet cells in the airway. So eventually, because of the swelling and the overproduction of mucus, airway obstruction occurs that could potentially result to airway trapping because of the collapse of the alveoli. And so that leads to atelectasis and hypoxemia that results to impaired gas exchange. So your priority nursing diagnosis for a child with RSV should be impaired gas exchange. And if your priority nursing diagnosis is impaired gas exchange, validate your diagnosis by looking at the arterial blood gas results of the patient. Okay, so since RSV involves inflammation of the airway, so what are the common symptoms? You have RSV, so respiratory distress, manifested by fast breathing, wheezing, retractions, and nasal flaring. S, secretions, so you'll see runny nose, cough, mucus plugging that causes congestion. And V, very irritable with feeding difficulty. Now, the irritability could be associated with a decrease in oxygen supply. This irritability could potentially lead to poor feeding, fuzziness, which could potentially lead to dehydration. Now, pay particular attention to the fact that in young children, infection, whether the viral or bacterial, is initially presented by a specific symptom. That is your poor feeding. So if a child does not really feed the usual way they do, then chances are they could be suffering from infection. Okay? For elderly patients, the initial sign of infection, whether viral or bacterial, could be confusion. That's why it will be asked about the initial sign of pneumonia in young children. It's going to be poor feeding, and for elderly patients, it's going to be confusion. Now, the priority intervention for RSV is to maintain an airway that's patent and to provide oxygen support. So maintain a patent airway by suctioning nasal secretions. Infants are nasal breathers. So if you don't suction their nasal secretions, it would be difficult for them to maintain their oxygen supply. And then provide humidified oxygen if the SpO2 drops below normal. So monitor the oxygen saturation levels of the child. Now, your RSV requires a combination of contact and droplet precautions. That's why if you need to cohort clients with RSV, it's safe to pair only with another RSV case. So for RSV, the best roommate, therefore, is another child with respiratory syncytial virus, and that has to be confirmed by the physician. If no same diagnosis patient is available, the nurse should place the child in a single private room to prevent cross-infection. Never cohort with immunocompromised patients because these patients are at risk for infection, infants without RSV, or those with other respiratory illnesses like pneumonia or asthma. So you cannot cohort a child with RSV with a child with pneumonia because the risk of transmission among patients with pneumonia or asthma is really high. So here's a quick fix tip. Treatment for RSV, since it's a viral type of infection, requires supportive care. When there is severe RSV, ribavirin is usually used for life-threatening RSV cases, especially if you have a child who is immunocompromised. Immunocompromised children, like preterm babies, okay, needs to be given your ribavirin. For the prevention of RSV, palivizumab, a monoclonal antibody, is given monthly during RSV season to high-risk infants, meaning preterm babies, those with congenital heart disease, and those with chronic lung disease. Now, take note, palivizumab is not a treatment. It is used for prevention of RSV. So if it's going to be prevention, then palivizumab. Treatment for severe RSV, then you have your ribavirin. Okay? So before we use the concepts which we just learned, let me say once again, congratulations to the world's oldest next generation NCLEX passer. Her name is Flor Pangilinan Villarreal from Ago Foundation College from Naga City, who passed the next generation NCLEX RN test for New York last December 2, 2024. So here we go. Let's move on now to case number 50. So on to case number 50. let's put into practice the functional concepts which we just learned. So a 7-month-old infant, Mateo, is brought to the emergency department by his mother due to increasing difficulty in breathing. She reports that he developed a runny nose and mild cough 3 days ago, but over the past 24 hours, his breathing has become faster and noisier. On assessment, Mateo is irritable, has poor feeding, that is a red flag, that's a sign of infection in children, and appears tired. His respiratory rate is 64 breaths per minute, that's high, with nasal flaring, that's indicative of respiratory distress, intercostal retractions, and audible wheezing. Pulse oximetry shows an oxygen saturation of 89% on room air. That is already a cause for alarm, although pay particular attention to this fact that if a patient has an oxygen saturation between 85 to 90, they have to be on their way to the hospital. Thick nasal secretions are noted, making it hard for him to breathe comfortably. That's another consideration that you need to focus on because infants are nasal breathers. The fact that the client has thick nasal secretions requires the nurse's intervention. The pediatrician suspects respiratory syncytial virus, a common viral infection in infants. Mateo is placed on droplet and contact precautions. Well, the precautions have already been presented in the case, so read through it, okay? Immediate interventions include suctioning of nasal secretions, providing humidified oxygen, and initiating IV fluids due to poor oral intake. The care team closely monitors him for signs of worsening respiratory distress or impending respiratory failure. Okay, so now let's go over the question. Which order should the nurse carry out first? Okay, since you have all of these options as correct, this question is asking you to prioritize. Are you going to start IV fluids at 50 ml per hour? Are you going to administer humidified oxygen at 2 liters per minute via nasal cannula? Are you going to suction the infant's nasal passages as needed? Or are you going to give acetaminophen 10 milligram per kilogram per RM for fever? Now, if you go through the functional concepts we talked about early on in this discussion, you'll notice that what we said is your priority should be to maintain a patent airway. So even before you give the oxygen, you have to ensure that the infant's nasal passages are clear. Therefore, the correct answer, which will you carry out first, would be number 3. Suction the infant's nasal passages as needed. For those of you who got the answer correctly, congratulations. And may I invite you, remember, preparing for the NGN requires more than just reading your notes, listening to lectures, or watching YouTube videos and whatnot. What's important is you have to learn how to navigate technology. And here at the Ray Gapuz system, we have the only next generation simulator that simulates the actual exam. And the most important thing is this is AI aided, okay? This is also our QUICKFIX classroom, and this is our classroom for our larger classes. Of course, we put premium into our students' comfort. That's why our restrooms are clean, and we have a mini students lounge next next to the classroom. Okay, so may I also invite you to please do subscribe to have more of these types of videos in our YouTube channel. We're nearing now 28,000, and I'm so glad that we are moving towards our goal together. Okay, so we have a promo. Get a free review from us if you process your NCLEX RN application with iTaps Gapuz. We have next-gen NCLEX application processing with free review. Just call our mobile number there. And once again, thank you very much for joining me in this video. Once again, this is your mentor, your fact check buddy, Ray Gapuz, at your service. Those who are taking the test within the week, good luck and God bless. See you in my next video.